Welcome to our May webinar, a collaborative presentation of the Federation for Children with Special Needs and the Recruitment Training and Support Center, RTSC. Today's webinar is Everything You Need to Know About Evaluations, What We're Afraid to Ask, presented by Kevin Domingos, PhD. As you may remember from part one of this series, Dr. Kevin Domingos completed his education and training at the University of California, Irvine, and Harvard University. He has previously served on the board of directors of the Massachusetts Neuropsychological Society. Kevin provides neuropsychological services to 12 schools in the greater Boston area. His specialties include forensic neuropsychology evaluations and reviews, independent medical evaluations, ADHD, traumatic brain injury, behavior management, and memory disorders. Welcome, Kevin.
Thank you.
I should say welcome back, Kevin.
That's right. Well, first of all, just wanted to thank Renee Williams again for inviting me twice to do the series of presentations, last time with attorney Daniel Heffernan, and also for the amazing work that she does here and the gala that's going to be coming up. So definitely if you can attend that, that would be awesome. And thank you, Mary Beth, as well, for moderating this. And if you have questions, feel free to write them in, and Mary Beth will be stopping me periodically so we can answer some of those questions. So one unique thing about me and the two companies that I have is I understand both school-based evaluations through Domingos and Associates and private evaluations through Boston Neuropsychological Services. And today we're going to be talking about those two different types of evaluations as well as school-based evaluations. The learning objectives for today. Basically at the end, my goal is to have you guys be able to answer some of these questions. What are your psychological evaluation options? And there are many, and we're going to be talking about a lot of those options today. What are the unique components and processes for each of these options? And then what is the utility of a neuropsychological evaluation? So let's first talk about the pre-evaluation process. So before you start, stop. So what does that mean? A lot of times people just dive in, and you are much more productive if you kind of stop and think and develop a plan before you kind of dive into the situation. The T stands for think about the people that you're going to need and interact with. Make a list of those individuals. It could be special education, teachers, of course, or other ancillary professionals. It could be speech and language, OT, the psychology department. And then also organize your approach. The final is before you dive in, of course. So the evaluation settings, there are many different kind of evaluation settings, and I spoke of a few at the very beginning, but the one that you're all probably most familiar with is a school-based evaluation. So we're going to start there today, but then some other unique situations. What about a private school or homeschooling? How about an outpatient clinic or hospital that has these types of evaluations? An inpatient evaluation, which may primarily focus on a psychological evaluation, and then a private neuropsych evaluation that you may go to an individual neuropsychologist or a group practice. And then finally in IEE, or an independent educational evaluation. So we're going to be talking about all of these different kinds of evaluations in all these various settings. So when thinking about the school-based evaluation, you might want to ask yourself a few questions. Who, what, when, where, and how. So who exactly is going to be conducting this evaluation? What are the credentials of the individuals? So it's certainly within your right to ask these types of questions and to identify and request a resume or a CV of the professional providing the evaluation. one thing that you want to be sure of is the credentials of the individual. Does it match the concerns that you have and the type of evaluations that are going to be conducted? Some schools, for example, share responsibility. So there may be one professional doing an IQ and a different professional providing the academic. But in terms of disability determination, those two components need to be combined together. So sometimes it's a little awkward just in terms of scheduling and coordinating a single document that addresses both of those issues. So it may be a little bit more streamlined if you have a single individual providing the services. So the what question. What areas need to be assessed? What are your concerns? And again, that first place of STOP, of get organized and really be specific and try to address your concerns. One way to think about the request, and we'll talk about the formal request process, is basically verbalizing all the concerns that you have, or having the teacher or child study team or whatever it may be communicate those concerns. So basically what you're building is a reason for referral for the evaluation process. And then the when. When is it going to be scheduled? Well, there's specific timelines and deadlines that the school needs to adhere to, and we'll be talking about those shortly. However, what classes are going to be missed by your child? Are they going to get behind if they miss one or more classes? So coordinating this is extremely important, and sometimes an issue missed or overlooked needlessly. Where is the testing going to take place? What kind of an environment? Well, needless to say, a quiet environment without a lot of clutter or distraction is ideal. You'd be surprised where your child may be evaluated. I've been in many, many different schools and seen a lot of a huge continuum of appropriate versus inappropriate settings. So it's a good question to ask. And then how will it be conducted? Now, this is extremely important as well. Some schools and individuals, based on scheduling, will test a child over multiple settings or multiple times. So that kind of an evaluation, let's assume that your child is tested over 5 separate days versus in a single day. So are the results going to be the same? Probably not. How are they going to be different? Well, sustained attention and concentration is really not going to be a potential limiting factor. So for example, if that's one of your concerns, but that's not evaluated in that manner, that could pose a significant issue and give you inaccurate results. The other important part to consider is the normative data that is being used. So all these tests are normed with thousands of children in a single situation, all-day assessment. So if the normative data represents all-day assessment, in my opinion, it should reflect or represent that type of data as well to give you the best results.
So just one quick question. Speaking about the where, does a parent have a right to see where the child will be assessed?
You can always request, and the schools may or may not give you that information because it may depend, right, on the day. And some schools have a scheduling nightmare of trying to find a room. Other schools have a designated space. So in those situations, if it is designated, why certainly I don't see any reason why you would prevent a parent from observing just to see if it's appropriate or if there's any issues that need to be addressed.
Okay, great.
So the pre-evaluation process, sometimes it's not really discussed. However, it can be extremely important. So for example, some schools have like a child study team that identifies a child at risk, or an RTI model of trying to implement strategies to see if that will impact a child. So the RTI model is extremely important, especially when evaluating a child who may be having a specific learning disability, because that data is extremely important that goes into that piece as well. So you might want to ask your school, do you have a child study team to really sink your teeth into what the issues are? And it gives you an opportunity to try out different recommendations. So the child study team and RTI is not meant to prevent the formal testing process. They can both happen simultaneously, so that's important to know as well. So the pre-evaluation process, part of that whole process is to identify potential issues, develop strategies, to measure those treatment strategies to see what works, what doesn't work, and that data is extremely important, should be reviewed and incorporated into the formal process, and especially at the feedback and IEP meeting, it's important information to consider. And then recommending what are the next steps.
Just one other question. Who would make up the CST or RTI team?
Right. So it depends on the school. Usually it's collaborative. RTI is based on the training, is specialized training, because there's specific approaches. There's 3 different tiers.
Mm-hmm.
I can provide a reference to that process. Actually, I have it with me, but I'll give it to you later, so maybe we can put it up on the web. And also, I'll have a number of resources on the website. At the very last slide, I think, is a reference to some of these resources as well. But so we can get that to you.
Thank you.
And then, of course, after you go through, if it's determined that the pre-evaluation process is something that is critical to try, if it's determined the next step is a formal evaluation process, we'll be talking about that process next. So, how to do that? Well, you always want to put something in writing, and that will automatically start the clock and start the process. If you informally or request, it may or may not happen. So remember that a formal request is critical and is necessary. Put it in writing. An ECF form, or an evaluation consent form, sometimes known as the N1A form, will be sent to the parent or guardian to be signed. And that form, the next slide, I'll show you exactly kind of what that form will look like. And the information that goes into that is a little bit different from school to school. So let's have a look at that form now. So on the DESE website, you can download this PDF form, but this is the top half of the full form. And what this form is intended to do is basically develop a reason for referral. And there's a section of a narrative to put concerns in as well. And the SPED director, who is going to be filling this out to send home, needs to identify what exactly is going to be accomplished. So as you can see, there's 5 basic areas, general areas of assessment. But basically it's to build the reason for referral. In some of the schools that I'm in, we put specific language, and I'll show you what that looks like next. So the ECF form, we actually identify what exactly we're going to be doing. What are the assessments? So if it's appropriate to do a psychoeducational evaluation, a social emotional, or an attentional, basically that's put into the ECF, and all of our reports, basically the title is psychoed, social emotional, and attentional. So you'll know exactly what has been checked off on the ECF and what tests and measures are going to be in this document. So these are some examples: psych ed, neuropsych, social emotional, attentional, FBA, or a functional behavioral assessment, and ADOS-2, especially if there's an autism spectrum disorder diagnosis in question that needs to be assessed.
And before we move on,
Sure.
when do you think it's proper to have a home assessment? I think people are concerned
Right.
about that.
The operational definition of a home assessment is confusing sometimes. It could be extremely concrete and actually be a home assessment, or it could be, a history of home and the situation over the telephone or in person. So it doesn't necessarily have to be a quote-unquote home assessment, but we incorporate it all the time.
Okay.
So if you look back at those 5 different areas, all of them are extremely important because you really need to understand the academics. You really need to understand the home dynamics and the medical dynamic and situation. So it would be helpful to have informed consents to then reach out to other ancillary professionals, the pediatrician, to see if there's any medical issues. So at the end of the day, what you generate in terms of your report is extremely comprehensive.
Great. Thank you.
Initial evaluation. There's an initial evaluation and a 3-year reevaluation. So we're going to focus on the initial school-based evaluation and some of the timelines. And these are all on the DESE website, but just kind of outlined here. Once the parent consent is sent, within 5 days, school days, important to note, of the referral needs to be set up. And then the second is test by date. Needs to be scheduled within 30 days following the receipt of the consent. Within 45 days of the written consent, the team meeting, eligibility determination, sometimes called a feedback meeting. These terms are used interchangeably, needs to be scheduled. Again, I can't stress enough that it's important, and on the DESE website it even states, appropriately credentialed and trained specialists need to administer all assessments. And this might be a good time to talk about requesting who exactly is going to be testing my child. So a lot of schools, they need to train new professionals. So sometimes you have a trainee, but a trainee can vary quite a bit. So on this continuum of trainee, you can have anything from an intern to a postdoc. So it's critical to identify who is going to be administering. In private practice, sometimes it's called a psychometrician. So it's an individual trained to administer. But in the schools, it really should be professional being present during the evaluation process whenever possible because of all the behavioral observations and the rich data that needs to be collected.
2 quick questions. Can you clarify the difference between a psychoeducational evaluation and a neuropsychological evaluation?
Sure. So a psych ed typically at a minimum will incorporate IQ testing and academic testing for the purpose of disability determination. Okay, so at a minimum, that's at the core. Again, on the ECF, there's other aspects. So, the home assessment and some of these other aspects. But at a minimum, those are the 2 areas that are going to be assessed with the ultimate goal of academics, learning style, and disability determination. Neuropsych eval, totally different evaluation. It incorporates that, but has many, many more aspects to it. Later on, we're going to be going into detail, but one way to think about it is 3 separate circles that overlap. And a neuropsychological evaluation will incorporate neuropsychological testing, psychological testing, and academic testing. And that represents a comprehensive neuropsychological evaluation.
Okay, great.
So the neuropsych piece incorporates the IQ, but also all the functional domains associated with brain function. So we'll be looking at at the very basic functions like attention and concentration, speech, language, visual perceptual abilities, language, expressive, receptive, executive functioning, social interaction. So these are all components of a neuropsych. They get incorporated, but we'll definitely talk more about that at the end.
Okay, one other quick question regarding consent. Does a parent have to consent for an FBA?
Good question. Typically, all testing, there needs to be informed consent and a dialogue with the parent, because the data that comes from all testing is going to be reviewed at a meeting and feedback. So you would have to have parent consent and through the process. If you didn't, you can imagine there would be all kinds of surprises. So that would definitely not be a good thing.
Okay, great.
Initial evaluation, required assessment. So all areas related to suspected disability, of course. Educational assessment, which should incorporate history of education process, students' attention skills, participation behavior, communication, memory, social relations with groups, peers, and adults, including with a teacher. To just follow up with that, description of a student's educational and developmental potential is extremely important. And then even actually, testing can start as early as age 2.5, actually. Some people don't realize that, but at age 3, it's meant you want to start at age 2.5 if there's developmental disabilities or if early intervention is involved, to make sure early intervention is involved by age 3, because research, of course, shows that the earlier the better for early intervention. Okay, and then finally, optional assessments. Comprehensive health, psychological, neuropsychological. Now, when I say psychological, it's not the same as a social-emotional. So a social-emotional evaluation, which is a term a lot of schools use, focuses on social-emotional interaction as it applies to academics and how it may impact academics. That's not to say psychological trauma is not going to impact academics, but it's a bit separate from the responsibility of a school. The school does not have the personnel to look at psychological issues of that nature. And then home assessment, we talked about what exactly that is as well. In terms of required aspects of a report, so after this initial evaluation, what actually has to go into a report? So reminder that these are at a minimum, okay? So the procedures used, the results, diagnostic impressions, define the needs, and offer explicit means of meeting them. So again, at a basic requirement, these are some of the components that need to go into the report. Depending on the training of an individual. For example, if a neuropsychologist typically is going to be coming in to do a comprehensive assessment within a school, or you want a private evaluation. At both my companies, we add a number of other areas that always go into a report. And some of these, the previous IEPs and what were the goals, grades, of course, standardized testing results, developmental history, milestones. We'll interact and get consents to talk with pediatricians as well. Understand the home life, family, medical, and psychiatric history as well, because there could be some genetic components that need to be evaluated. We always ask about the triad of health. And when I do training with my students, the 3 most important aspects of one's life, sleeping, eating, and exercise, and we always ask these questions. Especially with children these days, sleeping tends to be more and more of an issue, both on task demand at the school and, of course, screen time, the dreaded screen time. We've been developing special presentations regarding screen time. It's a big, big issue. Too much to get into today, but it's important to ask these questions and how it impacts socialization, bullying. There's so many things that screen time can impact, but it can impact. There's extra light at night that really can mess up your sleep-wake cycle. Overstimulation. It's basically, you can think of it as a drug. Think of it as just extra coffee for your child late at night, and what is that going to do to them? So, other areas, interviewing parents and teachers and the child, we always do that. A visual screener, what exactly is that? So, we actually look at the integrity of the visual system. So we have these little eye charts to get a rough estimate of visual acuity. Why is that important? I sat in on a neuropsych one time feedback meeting from an outside professional, and they were came up with a disability qualification of a specific learning disability of nonverbal visual perceptual deficits. And when I asked, well, did she have her glasses on at the time, and the individual said she wears glasses. So it's really important to look at the integrity of the sensory system before you get started, because that can really impact the data that is collected. Behavioral observations, we have two different types. One is a covert behavioral observation in the classroom, and we try to go into a classroom that the child may be struggling with the most. So it's a window of opportunity to see some of the behaviors that are going on, and of course, behavioral observations during testing as well. We always have a diagnosis section, a DSM or a ICD-10. ICD-10 is more of medical nomenclature for diagnoses that in private practice we're required to use for billing purposes. We don't always have a diagnosis in that section, but if we do, we put it in the report. And we always have a disability qualification section as well. Some schools do not allow their school psychologists to do these last two at all. And that's, we can talk more about that, or if you have any questions about that, we can go there as well. We also have a section of strengths and limiting factors. Well, the strengths section is important because it's pulled right out and popped right into the IEP, for example. There's a section. So what we do with those two sections is we rank order both the strengths and limiting factors. So the limiting factors are ranked ordered in terms of what is holding this student back from reaching their full potential. It could be from the test data that we've collected, or the observations, or the interviews with family. A child's parent might have passed away recently. It's not really going to show up necessarily on our test data, but it's definitely going to impact the child. So we would put it there as something to address in our reports. And the nice thing about the limiting factors section and how they're ranked ordered, it's a reminder for us to make a recommendation. If it's important enough to talk about as a limiting factor, it has to be discussed in terms of a recommendation. And speaking of recommendations, we typically break those out in terms of school responsibility, home responsibility, and ancillary professionals, pediatrician or outside therapist, and so on.
Before we move on, we have some questions about recommendations. Do the recommendations have to be, is it a legal requirement that they be written in the reports?
there should be recommendations outlined, and in that previous slide, a minimum requirement generated there as well. In addition, though, the IEP team, the feedback team, is going to be generating recommendations as well. However, if you think about the professional providing the evaluation, you can think of them as an expert. And who better to make a recommendation regarding a limiting factor as that professional, right? And again, they are suggestions. Sometimes schools or school districts get hung up. If it's in a report, I have to do it. And so sometimes I think that that's why they prevent their professional from putting it in, because they feel mandated to have to follow up with it. I disagree with that approach or philosophy. I feel that it's important for your expert to put as much information as possible, because that is your expert. But then all of those recommendations, disability suggestions, and qualifications can be discussed and officially, agreed upon at the final meeting.
Okay. There was a question, and sometimes this is a thing that you will hear or read in the evaluations from schools, is that the recommendations will be discussed at the upcoming team meeting.
Right. That is very common, especially for a school that prevents their school psychologist from doing anything in terms of diagnosing disability qualification or a recommendation. Really, it's a way to hedge by not locking yourself in. So we go back and forth. The schools that we interact with want our opinions. They view us as the experts. We don't try to overstep, but we are there to provide a valuable service. And they look to us for those functions.
Okay. We do have a specific question. You mentioned about glasses before.
Yes.
Now, what if a child has is being evaluated without their hearing aids or their FM system?
Right. So I want to see a child in their natural classroom state. So if a child typically wears glasses, they should wear glasses during testing. If they have a hearing aid or an additional device, then that needs to come with them as well. So it's basically having the situation mirror or parallel the situation that they're going to be in class.
Okay, great.
Okay. So at the meeting, after the reports or have been presented, the ultimate goal is basically disability determination. And there's a federal mandate and there's a state mandate. And sometimes those don't match up perfectly. However, if you go to the federal IDEA, there are more than just 10 disability qualifications. In Massachusetts, these are the 10. So we'll focus on Massachusetts, autism, developmental delay, intellectual impairment, sensory, and there's a wide variety of sensory impairments that you can see there. Neurological impairment, emotional impairment, communication impairment, physical health, and specific learning disability. Okay, so of these, there's maybe 2 or 3 that are handled a little bit differently. So autism, it's a disability qualification and it's a diagnosis. So it's a double-edged sword, and there's a lot of debate over, well, if a school professional does an evaluation and I suspect autism, but they're not qualified to do an assessment to diagnose autism or is not allowed to diagnose autism, how is it ever going to be determined that that's a disability? you can see the dilemma there as well. So that's one issue or problem that needs to be resolved. Another one is developmental delay. So typically that's given to a very young child with developmental delay issues. However, at age 9, I believe that a child can't have that designation any longer. And in order to continue with services, a different disability qualification needs to be determined. And then the third disability area that is unique is specific learning disability. So there's been a lot of debate over what exactly is a specific learning disability. There used to be this discrimination model of significant 2 standard deviation difference between IQ and academic performance. And then there was an RTI model, and I have a reference to some of those issues. Actually, it's 3 or 4 different pages that just talks about specific learning disability. If that disability is determined at the meeting, there's additional paperwork that goes with a specific learning disability and monitoring of that as well. So you need to keep those things in mind. So initial evaluation, feedback meeting, we've kind of talked about what goes into it. It should always start off with a question to the parent or guardian. And that question is, what are your concerns? These can be formal. These can be sent in ahead of time. I recommend, again, the STOP of organizing. And this is just one of those organizational strategies and techniques, is write down your concerns in enough detail so it will inform the team so they can address these concerns. I would also suggest that you would rank order your concerns as well. So if for whatever reason you're running out of time, you definitely get your concerns addressed. The feedback meeting will also go over all of the results, of course. Diagnostic impressions, that's actually a quote from Deci. Disability qualification, of course. Define needs, and offer explicit means of meeting them. Also at the feedback meeting, what happens if you are dissatisfied with the results or the process? What happens if, say, 6 months or a year later after the evaluation, you're still not satisfied? Well, there is a process, and it's called the IEE, or an Independent Educational Evaluation. State law says that parents or guardians have the right up to 16 months following that initial evaluation to request formally an independent educational evaluation. So, what does that mean? That means that the school has an option. Once the parent requests an IEE, basically the school has the option to pay for an IEE, and it's an independent, so it's not going to be completed by a staff member of the school. It would be independent of the school. Some schools have a list of individuals to provide IEEs. However, if you have somebody in mind, you can bring that information to the school as well. And as long as the expert is qualified, that the school has to choose that individual to perform the evaluation. A sticking point historically has been something called state rates. So state rates is the school is mandated to, in some situations, based on your income, and they may ask for some of those information and data and maybe tax returns, but they're mandated to pay for, but at a state rate, reimbursement rate, which was quite poor up until recently. Just a couple of months ago, actually, there was an increase in the rate and actually an increase in the number of hours. For example, a neuropsychological evaluation now ranges from 9 to 20 hours, for example. And there's operational definitions of who can do various types of tests. So I will provide a reference to some of that information, which just came out within the last couple of months. Getting back to the IEE, parent has a right to request the school to pay for IEE rate setting, but that's going to improve, so that's actually quite nice. This school will typically agree and pay for it. However, sometimes you have some pushback. When the school doesn't have the staff, for example, needed to perform certain types of testing, like we were talking about autism or ADHD. So in those specific situations, if those issues are being raised and you're not satisfied with the evaluation, that would be a clear example of requesting an IEE. You need an appropriate credentialed and trained professional to provide an evaluation to look at ADHD or autism or a whole host of other issues that will or could impact education and identify a disability for qualification purposes.
One quick question that I have, and I have seen before, is having an intern do the evaluations and then it is signed off by a supervisor. Is that considered, a qualified individual because the supervisor hasn't actually done the testing?
Right. It depends on the situation, but typically if the supervisor is signing off, they're signing off on all of the data and results, and typically work fairly close with the trainee. We have postdoctoral students, so they've gone through a doctoral program, they've graduated, they have their doctorate, but even in those situations, the individual is well trained. That's not always the case, so kind of buyer beware. See exactly, because just because a professional who may not be licensed or certified doesn't mean that you're going to have a poor report necessarily. And with good supervision, actually even more time is going to be going into that evaluation than what would normally go into. So it's not automatically a poorer product. Sometimes it can actually be better because there's, sometimes two heads are better than one, so to speak.
Okay.
Not necessarily. Okay. So next under IEE, once a parent sends a formal IEE request, the school needs to file either do one of two things. File a due process that basically says, no, we think what we did was fine, and it goes to hearing to demonstrate that, yes, in fact, that's true or not. Even at the hearing, though, if the hearing officer determines that the school is not obligated to provide funding for an IEE, the parent or guardian still is able to do their own IEE. So in this situation, it would be considered a private evaluation. So at that point, that evaluation can be pulled back into the school, and a formal meeting to go over the results has to happen as well. So that's the one of two processes regarding the IEE. So who performs the IEE? We talked about that already, actually. Understand the skill set of the individual, and again, it should match concerns and especially the disability. Can a parent request their own evaluator? Of course, the answer is yes. You may get some pushback saying, that professional is not part of our list. Well, you can request that professional be part of the list. So you can definitely push back for that. So a new approach. We've been kind of playing around with this model, and I've been talking to different schools and different school districts regarding this as well, because being in private practice, third-party reimbursement, like the Blue Crosses of the world, Tufts, Harvard Pilgrim, are very, very good and astute to what they will and will not pay for. They're very, very good at it and ahead of the curve. So they will never pay for anything academic or under the purview of a school and a school's responsibility. However, the opposite is not always true. A school, in my history working with schools, they don't understand how they can push back. So medical necessity, for example, is the responsibility of medical insurance. So there are a neuropsychological evaluation and a psychological evaluation. If there is medical necessity, comes under that umbrella of insurance. Academics, it's the school's responsibility. Again, the schools need to understand when they can push back and when they can't push back. However, for an IEE, one of the models that I was coming up with is, wouldn't it be nice to have shared responsibility of the parent, the school, and the private insurance company? So not one group has all of the financial responsibility, but it's shared. In that model, you're going to get possibly a much more comprehensive assessment, but it's shared cost between all three of those groups. So it's something to consider, and I'd be more than happy to talk to anybody about that. We were reviewing the different kinds of evaluation settings. So we've been focusing on schools. However, there's other types of settings that you need to be aware of. Outpatient hospital-based settings, so the children's hospitals or the Mass Generals or the Brighams, or there's a number of children's hospitals out there that you could get an evaluation. Advantages and disadvantages. A hospital-based evaluation, sometimes you're on a very long waiting list. Hospitals typically accept mass health, which is good, because there's fewer and fewer professionals out there who accept mass health, unfortunately. However, the wait lists can be extremely long. So one technique to use is sometimes they have wait lists. So you might want to consider multiple wait lists rather than just putting all your eggs in one basket, because sometimes a hospital will have a cancellation. So you might get bumped up. So don't just look at one hospital-based, if that's the direction that you want to go. You might want to get on multiple wait lists to be a little bit more efficient there. Inpatient, a lot of these types of evaluations typically focus on psychological issues, and schools really aren't equipped with these types of evaluations, but it impacts schools quite a bit. And then you're probably most familiar with a private evaluation. It could be a private neuropsychologist or a group practice that specializes in these types of evaluations. Payment source. So typically all of these types of evaluations, the payment source is either insurance or private pay. And again, sometimes parents are extremely surprised that they have to pay for the academic piece. Remember, a comprehensive neuropsych has 3 different components to it: neuropsych, psych, and academic. It's the parent's responsibility to take care of that piece, but we need all 3 of those pieces to truly understand what's going on with your child. So private evaluations, let me just go into a little bit more detail because there's a lot of subtlety and nuance here. In insurance-based evaluation, it's definitely not one size fits all. Every insurance has a different kind of plan or a policy. Is it a HMO? Is it a PPO? What is the authorization process? So again, partnering with individuals who can help you navigate this whole system is extremely important. We have an admin team that if you call in, will run the insurance information for you and let you know exactly what your responsibility would be. So when you reach out to an individual or a group, make sure that they have that service and they can help you through that process. Once they will run your benefits, and you can do this as well, actually. It's time consuming, but you can find out exactly what your benefits are. So what they will typically say, insurance, we'll just pick one, like Blue Cross, for example. They will look at medical necessity. So what is medical necessity? So if we're looking at two of those different types of evaluations, a neuropsych and a psych eval, medical necessity is basically you need to rule out a diagnosis based on the history and concerns. So you may or may not have medical necessity for a neuropsych, but if you do, it's going to be based on a diagnostic code, or that ICD-10 or DSM code, typically ICD-10. And the procedure, so a neuropsychological evaluation, the procedure code is a 96118. So that represents exactly what's going to be accomplished. A comprehensive neuropsychological evaluation, medical necessity, the rule-out diagnosis, okay, based on the history and the intake information that is received. A psychological evaluation is a 96101. And again, the third component of the comprehensive neuropsych is the academic, and again, that is the private pay only. There's a reference at the end regarding CPT codes if you have additional questions there. Private evaluation, issues to consider. Who is a neuropsychologist? I hear this all the time. So there are many issues that need to be considered, and buyer beware. Unfortunately, right now, in the state of Massachusetts, there is no such thing as a licensed neuropsychologist, and it's not illegal to call yourself a neuropsychologist. However, there's definitely guidelines by the American Psychological Association and board-certified definitions and so on. So, who is a neuropsychologist? Typically, it's a doctor-level professional who has a training during internship and postdoctoral training with a neuropsychologist as a supervisor. So the American Psychological Association developed Houston guidelines in a conference that was held in Houston. And Division 40 is the division under the American Psychological Association that's specific to neuropsychology. And so the operational definitions that's typically looked at is there. So buyer beware, ask again about training. If, for example, a school is attempting to do a neuropsychological evaluation by a master's level school psychologist, it's not a neuropsychological evaluation. They use techniques and tests, but what goes in to the interpretation, conceptualization, and the training of brain-based behavior is something totally different. So be careful of who is doing your neuropsychological evaluation. It does require specialized training and supervision. For example, Blue Cross will impanel a doctoral level individual to perform a neuropsychological evaluation. A master's level school psychologist cannot be impaneled with Blue Cross. So even Blue Cross has some differentiation about who is or who cannot do these types of tests. For example, if you have a certain type of insurance and the professional that you want to go to is not impaneled with that insurance company, you still have some options. In this day and age, it's sometimes hard to find a professional in your insurance panel. So you can actually request an out-of-network benefit, and sometimes that's explained in your insurance. Or another option is something called a single case agreement. So even if your plan does not have out-of-network benefits, through negotiation you can still arrange a single case agreement to do a comprehensive assessment even if you're not impaneled. You just need to be somewhat persistent to do that. And again, no insurance will authorize academic testing. So the utility of a neuropsychological evaluation. So one of the early questions is, so what's the difference between a psych ed and a neuropsychological evaluation? A neuropsych assesses many different kinds of domains associated with brain functioning. So there is an overlap, like intellectual functioning and IQ. A psych ed is going to have that piece as well. However, it's going to go into greater detail in terms of walking around the brain, looking at the integrity of the system and how one processes information, not just how one learns. So the focus of a psych ed is just how one learns primarily and impacts academic performance. A neuropsychological evaluation looks at strengths, limiting factors, the integrity of brain functioning, language, visual spatial, motor, learning and memory, academic achievement, attention, executive functioning, which is a huge issue, social, emotional, behavioral functioning, and adaptive functioning. And the key component is a skilled neuropsychologist is basically able to, through diagnostic impressions section, really kind of pull together the conceptualization of the case to help parents and schools really develop kind of a game plan or a blueprint through recommendations of understanding what's holding this child back in a wide variety of ways. But the focus tends to be looking at both diagnostic clarity, addressing symptoms, and then focusing on recommendations as well. As I stated before, we really like to rank order what those are and then summarize the results and help guide the recommendations, both school, at home, and then outside professionals. The recommendations really need to be specific as possible. They need to be quantifiable whenever possible, specific to that individual. Sometimes I see in reports it's very cookie cutter, so to speak, and it's like ADHD. Oh, I'm going to give you 50 different recommendations regarding ADHD. That's not as helpful as really identifying what are the specific nuances of this child in terms of attentional issues, because again, it's not a one-size-fits-all, and you really need to identify these limiting factors. So recommendations, you want to address the parent and the teacher concerns, guided by history, behavioral observations, test results, of course, and then provide resources, which we're going to be doing for you all as well. But a good, neuropsychological evaluation will help you with the next steps, not just what the school can implement, but other outside resources like the Federation. Good segue. So I think I'm just about out of time, but I thank you for your time and your attention, And again, if you have any follow-up questions, feel free to send those in.
Great. Thank you very much, Kevin.
Thanks.
That was extremely helpful.